Afternoon, class. My name is Courtney Anthony, and I will be presenting structural family theory and family systems theory. Structural family theory centers on examining the family's organization, which includes its hierarchies, subsystems, and boundaries to help foster better communication and functioning. Structural family theory was developed in the 1960s by psychiatrist Dr. Salvador Minuchin. Dr. Minuchin was an intake psychiatrist at Whitwick School for Boys. Whitwick School for Boys was a residential facility in New York for delinquent juveniles. Dr. Minuchin believed traditional therapeutic approaches were not successful when working with this population, and he thought the goal should be to focus on the juveniles' families. The theory was first published in the book Families of the Slums in 1967 and then published again in 1974 in the clinical book Families and Family Therapy. Structural family theory is not limited to a specific family structure. This theory could be used on blended families, multi-generational, or extended families. It also can be used on families with a variety of problems or challenges, including adolescents with behavioral problems, families with trauma, or families with mental health issues. Principle of structural family theory is that individual problems arise due to a dysfunctional family structure. Core proposition is that family is a system, and when one family member has a change, then other family members are affected. Key concepts of structural family theory are family structure, subsystems, boundaries, and hierarchies. Family structure is the way in which a family interacts. The structure determines who talks to who makes decisions, and who holds the power. Subsystems are smaller groups within the family system. A subsystem could be the parental subsystem or a sibling subsystem. Boundaries are unspoken rules between the subsystems, and the hierarchy is the distribution of authority and power within the family structure. Key terms and concepts of structural family theory are joining, structural mapping, enactment, restructuring, unbalancing, and reframing. Joining is the first step in the therapeutic process. The therapist will build rapport, temporarily adapt to the family's current rules and patterns, approach the family with curiosity, display support for all family members, and highlight the family's strengths. Structural mapping is when the therapist creates a visual map of the family's subsystems, boundaries, hierarchy, and dysfunctional alliances. Enactment is when the family role plays and interacts with each other. Restructuring involves enactment and setting boundaries and redefining roles. Unbalancing is when the therapist temporarily aligns with a less powerful family member to disrupt the dysfunctional hierarchy and to shift power. This could be when the family member aligns with a shy parent and ask them to speak up to a more powerful family member. Reframing is a shift from individual problems to systemic problem and highlight positive intent, create capacity for change, and focus on the present or the here and now. Strengths and weaknesses of structural family theory. One focuses on observable action. The therapist is able to observe and intervene in real time. Rapid and measurable change. Due to the therapist focusing on the family structure, this can produce lasting behavioral change. Clear goals and interventions. This theory provides a clear framework for assessment and a direct set of intervention techniques and for empower the executive system. Um, this empowers the parents to be the parents and set clear boundaries. Weaknesses, risk of therapists over directiveness. The therapist plays a more active role in treatment, which could lead the clients to be overly reliant on the therapist's input rather than developing their own autonomy. Insufficient focus on individual emotion and insight. This theory can feel dismissive to clients who seek a better understanding of their emotions or trauma. And seven, cultural and power blind spots. This theory's concepts can be harmful due to diverse cultures with different values and family structures. How is structural family theory useful for social work practice? Structural family theory provides the social worker with a clear, observable model for assessing and intervening in family dysfunction. This theory can be used in multiple social work practice settings, and this allows the social worker to work within a set time, work on concrete issues, and have concrete behavioral goals for the family. So, a proposed intervention. My case scenario is the mother and son are enmeshed, which means closely bonded, and the father is disengaged, which is leading to the son's disruptive behavior. The goals of the intervention are to strengthen the marital relationship between the mother and father and loosen the bond between the mother and son to stop the son's disruptive behavior. My intervention steps would be one, join the family session and assess family dynamics and structure. Two, map the structure and create a visual guide for the family so that they can see their current hierarchy and boundaries. Three, have the family role play so that they can show me as the social worker how they currently behave with one another. Four, unbalancing. I would side with the father to strengthen his position in the family hierarchy. And five, reframing. I would help the family restructure the hierarchy and help them set clear boundaries and clear child boundaries. Family systems theory is a theory that views the family as an interconnected emotional system. This theory suggests that an individual's behavior is influenced by and affects the entire family system. It was developed in the late 1940s, early 1950s by psychiatrist Dr. Murray Bowen. Dr. Bowen developed his theory after conducting research at the Manager Clinic in Topeka, Kansas, and the National Institute of Mental Health in Bethesda, Maryland. Dr. Bowen's research consisted of studying whole family units that lived in an inpatient residential facility where adult family members were suffering from schizophrenia. Family systems theory is not limited to a specific family structure. The theory can be used on individuals, couples, families, and extended families. It can also be applied to mental health disorders, conflicts between family members, emotional dysregulation, or stressful events. Key concepts of family systems theory are differentiation of self, triangles, family projection process, multi-generational transmission process, emotional cutoff, nuclear family emotional system, sibling position, and societal emotional process. Differentiation of self is the capacity to preserve individuality and autonomy while actively maintaining emotional ties with the family. Triangulation is the automatic process where a two-person system under stress involves a third person to lower tension. Family projection process is a process where parental anxieties are projected onto children, thus shaping the child's behavior and development. Multi-generational transmission process is the emotional and relational issues are passed down from parents to children, influencing each generation's level of differentiation. Emotional cutoff is a person distancing themselves from family to avoid conflict, which fails to resolve the core issues. Nuclear family emotional system is emotional issues in the family manifest through specific patterns between spouses and their children. Sibling position is The order of one's birth helps shape personality and dictates specific roles and ways of interacting with parents and siblings. An example of this would be um, the term middle child syndrome. The middle child is probably feeling neglected and overlooked compared to the older or the younger siblings. Societal emotional process is broader societal forces impact family dynamics and family emotional process. Strengths and weaknesses of family systems theory. One strength is this theory allows a holistic view, which means the individual is not the problem and blame falls on the family unit. Two, differentiation of self. The client has a sense of individuality, asserting their own needs and boundaries while maintaining interconnectedness with the family. And three, this theory is applicable to various issues. Weaknesses include cultural implications. This approach may not be applicable to certain cultures, ethnic or non-traditional family structures. This theory allows the therapist to be neutral in cases of abuse and violence, and this non-blaming approach can minimize the abuser's responsibility. And three, the potential to minimize individual issues. This approach may overlook or minimize a person's personal trauma or abuse. How is family systems theory useful for social work practice? Family systems theory helps shift the focus from identified patient to the family system and helps reduce blaming. Social workers can help clients to promote differentiation of self and autonomy, and family systems theory helps foster a strength-based practice by emphasizing how vital support systems are for improving client results. My case scenario is that Joe is the father. He works a lot. He is emotionally distant with his wife and avoids conflict. Tracy is the wife. She is stressed and anxious about the daughter and her schooling and criticizes her husband. Megan is the daughter. She avoids school and has severe anxiety. The assessment is that there appears to be a triangle relationship between Joe, Tracy, and Megan. Tracy and Joe appear to have low differentiation of self. Tracy is emotionally reactive to the conflict, and Joe uses emotional cutoff to cope with the stress. And there appears to be marital conflict and child impairment, which is Megan's anxiety and refusal to go to school. My proposed intervention, one is to complete a genogram. Completing a genogram helps the family recognize recurring patterns across generations. Two, reframe the problem. Reframing helps the family define Megan's school refusal not as a problem, but as a symptom of how the family is managing its anxiety. Teach concepts of triangles and differentiation of self. I would teach concepts and explain how the parents' emotional tension and conflicts are enhancing Megan's anxiety. Opposition statements. I would have the family use opposition statements to express feelings without blaming. The goal of this is to detach Megan from the family triangle. So an example of an opposition statement would be saying, I feel lonely when you don't spend time with the family, instead of saying you're abandoning the family when you don't spend time with us. Five, process questions. So I would have the family ask concrete questions to encourage the parent to think about their own roles in the family's emotional process. Six, complete tasks to interrupt the triangle. I would assign tasks to Tracy and Joe. I would instruct Tracy to reduce her questioning of Megan regarding school and reduce her criticizing of Joe and instead focus on hobbies. And then I would instruct Joe to increase his non-work time and spend that with his wife. And the goal of this task is to shift anxiety out of Megan. 7, re-engage Megan in the treatment. So I would re-engage Megan in sessions once the parent's anxiety is lower and they are better connected as a system. I would have the parents set clear boundaries regarding school and child responsibilities. The hope is that Megan's anxiety has decreased by this point. 8, discuss how to engage future conflicts and stressors. I would help the family to discuss how to apply their learning to future conflict. And then termination. I would terminate when the family demonstrates the ability to manage their anxiety and conflicts. How are family systems theory and structural family theory alike and different? They both see the family as a system and both project the idea that A causes B. How they are different. Family systems theory's primary focus is intergenerational emotional process and differentiation of self, while structural family theory focuses on organizational structure, boundaries, and hierarchies. The time frame is different. Family systems theory tracks historical or multi-generational patterns, while structural family theory focuses on the present and the immediate family patterns. And the therapist roles are different. In family systems theory, the therapist is neutral and acts as a coach and educator, while structural family theory, the therapist has an active role in joining the family and has a direct approach and challenges current dynamics. References, and thank you guys for viewing my presentation.